Hello, this is Danita from Training and Development, and I want to talk to you about using the CNA Workflow page. The CNA Workflow page is designed for you to use while giving handoff report and also throughout your shift to review information, and you can actually enter information through this page as well. So the CNA Workflow page is the first page that you see once you open a patient's chart. You can see that you can still see your main menu here to the left. In the center, you have kind of a mini menu. This is your navigator, and this helps you navigate different components of your workflow page. Each component is set up with a refresh button. Some components you can see under reason for visit, that's not been entered by the provider, so that's not showing there yet. But under vital signs and weights, so for instance, you can see the last set of vital signs that were done. You can also see a weight that was entered here, numeric rating. This is going to be the patient's pain score. Also, you can get to the interactive view where you can chart here. So if you want to, you can click here on where it says vital signs and weights. That will take you right to interactive view. You can also hit the plus sign, or you can do the drop down and go specifically to the part of interactive view that you want to go to. So I'm going to go ahead and select CNA Quick View. That's going to take me into interactive view, and it should open up my quick view. I'm just going to click close on that one. And you can see here's where my vital signs can be entered. So I'm going to go ahead and double click in my blue box here, and then I'm going to start entering some data. Okay. To sign this documentation, I'm going to click the green arrow or the green check mark, and then I can just click this back arrow here and go back to my CNA Workflow page. When I do a little refresh of this component, I can now see the new information that was added. Handoff summary is designed to point out anything that you for sure want to make sure you're passing on to the patient care technician that is taking over for you. This is going to include your fall risk score if they're high risk for falls, oxygen therapy. The next one is safety, so skin risk assessment. The nurses do that. If it's abnormal, you're going to see a change in color. It's either going to be blue for low or it's going to be orange for high. So kind of pay attention to those. Those are going to be good indicators if you need to take extra precautions with your patients. So you can see we just can move down here. I&O, we don't have any results on this particular patient. Orders, I do encourage the patient care technicians to check orders. That might be a change in workflow for you if you're coming from a facility where you didn't really have to do that. But here at Great River, it really is important to try to do that, just because orders can be entered at any time throughout the course of your shift by a provider, and you can have actually quick information if you need to collect a specimen, if there's a change in their activity or their diet, or if maybe you need to make them MPO for an upcoming procedure. You can see that quickly without the nurse having to track you down and tell you. So always check your orders, and we'll go over a little bit more of that in the Care Compass review piece. Allergies, it's important for the PCTs to know what types of allergies your patient has, who the care team is. The admission forms, when a patient is admitted, it is the responsibility of the patient care technician to complete this basic admission information adult form. You're going to find that on your admission forms tab on your CNA Workflow page or under that component. So to open that form, you just click on this link, and it's going to open up that form. Okay, so we can throw in our temperature here, we can throw in our blood pressure, and the aides, the patient care technicians, are responsible for completing this. Now, if your nurse tells you that they've already done it, that's fine. You also want to come in and check the second page. So there's the vitals page, there's also the safety page. And you do need to make sure this is all completed. Okay. And then to complete this documentation, there's a green check mark towards the top left of that window. You check that. If you need to return to it, if it's not complete, you hit the save, but at some point somebody does need to go back and sign this form so it becomes a part of the permanent record. If you don't sign your forms, they do not become part of the permanent chart. All right, so I'm going to go ahead and click my green check mark, and we're going to Sign that. Once a document is signed, I went back into it. Every time you click on that link, it's going to open a new form. So every time a document is signed or saved, you're not going to want to go there to find it, okay? You're going to find that in your form browser, which we do talk about in a little bit different segment, but just as a review, if you need to open that document to finish charting on it, you're going to right click on it and select modify, and then you can open that current form. So you're not starting a new form every single time if you weren't able to finish. My suggestion is do your best to get it complete and just get it signed so nobody has to worry about going back to it. So I'm going to go ahead and close that. Back to the CNA Workflow page. So as you can see, situational awareness, actions and situational awareness, this is a great place for people to enter information that we want to make sure gets communicated on, but is not necessarily going to be part of the patient chart. So for instance, you can see here that somebody put a note in, prefers Coke over Sprite. So this is a great place to communicate some of those simple things that we don't necessarily document in the chart or we wouldn't normally see, but it is on this workflow page so we can see it easily. What's really nice is that this flows between the nurses and the CNA's workflow page. So if you put a little note in about, patient prefers applesauce over pudding, then your nurse is going to see that as well. So that will actually help them with some of the cares they do as well. Discharge planning field, that's once they have an anticipated discharge date, you will see that in this field. And then lines, tubes, and drains is where you're going to see if they have an IV, if they have a Foley catheter, or if they have a surgical drain that you need to empty. So that's your CNA workflow page. Again, remember each component has some documentation functionality to it. They all have this little refresh, so you can always hit it refresh to pull in up-to-date information, or you can use the main refresh here in the top right, and that will refresh the whole page. Thank you and have a great day.